Okay. Good morning, and more adventures on. Good morning, and more adventures on Dara Learns the Internet. We are up and ready to go. So today I thought we could talk about learning styles and how that impacts your physical therapy. I'm going to throw in the comments a link to the VARK website, which is the sort of the overview of the general learning styles. So this is a questionnaire that you can fill out that will help you find your best learning style. And you can take that information with you to physical therapy and tell your physical therapist, like, hey, this is the way that I learn best, so that we can meet your needs. We can sort of tailor the way that we treat you to what helps you get the information best to stay in your mind, so that not only you can apply it during your physical therapy that you're getting now, but in the future you'll have that retention because we've taught it to you in a way that best coincides with how you learn. So the first type of learners in VARK is visual, and so these are the folks that see something and they learn it. So they learn by observation. So if I'm going to teach you an exercise, you're going to need to see me do the exercise in order to best have that go into your information centers. Giving you a handout with pictures on it, drawing a diagram out for you of exactly how you should be moving. In a classroom setting, a whiteboard, seeing that information gets it into your brain better. And the way that as physical therapists we can help you with that, again, is we can physically show you things. If we're trying to explain to you an injury, we can pull up an image of that injured body part and talk to you about how it's injured and why it's injured and what exactly is happening. And with that comparison with what you're seeing, it should help you understand what's going on a lot better, and we should be able to get your exercises to create habits a little bit easier. If you have that handout, if you have that piece of paper that you can look at the exercises every single time and be like, oh, right, that's how it goes. Or we can videotape ourselves, or we can videotape you doing the exercises so that you can reference that later. You can pull it up and be like, oh, right, that's exactly how it's supposed to look. The A in VARK is, it's just fun to say. The A is for the auditory learners. So these are the people who really learn best with sound and music. They typically have a good sense of rhythm. So if you're doing exercises to a beat, maybe like a metronome app on your phone will help you consistently get that exercise down, and you'll remember what it looks like. Or doing the same exercises to certain pieces of music will be helpful. If you have like your exercise soundtrack for your physical therapy exercises, you know that like in this part of the song you do this exercise or this activity. You may benefit from bringing your own music in. If you want your physical therapist to set you up with your exercises to a certain piece of music, bring that piece of music in for your physical therapist and say, hey, is this the right beat? Or you can talk to your physical therapist about the type of music that you're listening to that will set the pace for you as you're doing the exercises. So if you have that handout, you can see what it is, but you also can remember, this is when I take my break, this is when I do my reps, this is how fast I should be doing my reps. And so music can help you either speed up or slow down your exercises. For our verbal learners, these are the people who prefer somebody to speak directly to you. So you don't necessarily need a piece of paper or something auditory as far as sound to space that out. But these are the people who benefit from having a written exercise program. So not necessarily a visual picture of it, but a written description as I explain it to you. So lift leg to the side, bring leg backwards. Those very step-by-step written out instructions, as opposed to seeing the image of what the exercise looks like. And again, so knowing this about yourself will help you educate your physical therapist on the exercises that you're most likely to do based on the provided materials. So if you come in and your physical therapist gives you an exercise program that's just pictures, the likelihood that you're going to be consistent with them because you understand them is lower. The likelihood that you're going to remember them long term, if this injury flares up again, is lower. But if you have step-by-step instructions from your physical therapist written down in a manner that allows you to visualize exactly what's happening in each step, not only are you more likely to do them every time because it won't be difficult for you to comprehend what it's supposed to look like, but it'll be easier for you to remember in the long term. If that injury flares up again and you have to self-treat at home, then you'll know exactly what you're doing. You'll be able to reference back to that that written piece of paper that has the directions right out. Kinesthetic learners are people who tend to learn with moving their bodies, and so like sports, active play. Kids are really amazing kinesthetic learners. Kids are really amazing learners in sort of incorporating a lot of these things together. Think about your kids. I mean, they learn how to move their bodies when music is playing. They learn how to react and grow their balance when they're jumping off things and touching and moving. And they really incorporate the visual aspect and the auditory aspect and the kinesthetic aspect. So kids in general are just, they're little sponges. But you think of a kinesthetic mover, so the sense of touch. So if I'm asking you to do a movement where you're bringing your arm up and away from your body and down, the fact that I could guide you to do that movement is going to help you learn what it's supposed to feel like in your joint spaces, as opposed to you seeing me do the movement and trying to mimic me. So that physical hands-on touch of a therapist helping you move you through the movement so that your body can get that kinesthetic awareness, so that you can learn what you're supposed to be doing, is helpful for learners like this. Mathematic, logistical learners, I think the explanation of the body part, its mechanical function, and your process in healing that mechanical function, or your process in controlling that mechanical function, that type of explanation helps a lot with logistical learners. So people who really enjoy that cut and dry mathematical explanation of things, it's very helpful for your physical therapist to break down exactly what's going on. So what is the normal movement space of that joint or body part? What are you doing that is abnormal in that movement pattern, and how can we fix that to return it to normal? And I think a lot of times for people who are logistical learners or that mathematical learner, it's so beneficial for them to know what got injured, how it was injured, why it's not recovering, and how they can participate in the recovery. So really being able to have full knowledge and understanding of the injury in order to progress is, again, not only beneficial for the in the moment physical therapy when we're actually hands-on fixing the problems, but also long term, if that injury flares up again, if that injury repeats itself, then you have the full capability to remember how it was fixed in the first place and try those methods on yourself before it gets worse in the first place, or before you can return to physical therapy. And having that piece of knowledge about, again, how best you learn will help your physical therapist help you through your recovery faster. And the last is an interpersonal learner. So these folks really learn best in a group. I'm sorry, not the last, there's one more. Solitary learners. Totally forgot about you guys. But an interpersonal learner learns best in a group. So this might be a situation where you have two patients who are good at feedback, with giving each other feedback, and having an honest discussion with your physical therapist about your ability to work in a group is really beneficial. Obviously, we can't team people up unless they've given their approval, unless they're very comfortable with it. But having your physical therapist know this might be able to involve a friend at home, or a spouse, or somebody else they know who's recovered from this injury that they could share your journey with, or somebody that you've met that you can share your journey with, that will help you through these exercises, through the recovery process, through that group work. So a group class might be really beneficial for a post, like after that initial acute injury recovery. You might really benefit from taking a group class. to focus on strengthening that specific body part, or getting your kids to help you, knowing that if you tell your kids, okay, every day we're going to do our exercises, and having your kids sort of give you that feedback and that reinforcement and getting them excited about doing it will also reinforce your excitement about doing your exercises. And that will be helpful for your recovery. And again, in the future, having this piece of information, knowing that you need that external reinforcement is greatly beneficial for any recovery that you have to do. And lastly, we have our solitary learners, our intrapersonal learners. And they prefer self-study. Patients that really enjoy that self-driven, independent work. They're self-aware. They're in tune with their thoughts and their processes. These folks are really, if you are a learner who reinforces your own information as far as physical therapy goes, the physical therapist can give you all of the information in the world and all of the correct places to look to self-perpetuate your progress. So we can give you the appropriate YouTube tutorials if you're looking for how to progress your own exercises once that initial recovery period has been treated. We can teach you a progression of exercises through demonstration or a handout, and we can talk to you about how, when you feel comfortable with this part of the exercise, when this becomes easy, this is the next step. And these learners tend to really take hold of their own recovery and their own ability to progress through. So I think that in itself is invaluable. Just knowing how you learn best and being able to communicate that with your physical therapist will really help them get you where you need to be faster, because they will know exactly the right style of information to provide you with to best progress you, and also to get it in here. Because the faster it gets in here, the more motivated you are to do it, the easier it is to do, which helps that motivation, the faster the recovery, with your compliance with exercises. And and then they'll know the best way to get the information to you. So if you have any questions, reach out. Happy to answer them. But that link right there has a questionnaire to help you find your own learning style. And as always, our website has a great blog on the different ways that your learning style can affect your physical therapy. So feel free to circle the one you are, print it out, send it off to your physical therapist, so we know the best way to care for you. All right. Bye, guys.